Welcome to the ECG Fundamentals series, where I will transform the art of ECG interpretation into something clear, structured, and easy to grasp. Whether you're a complete beginner, a medical student, or a healthcare professional looking to refine your skills, this series will take you from zero to hero in ECG interpretation. No more struggling with complex concepts. I'll break it all down into digestible lessons that make sense. By the end of this journey, you will not only understand ECGs but also confidently analyze them, identifying normal rhythms and detecting abnormalities with precision. So, let's begin this exciting journey into the world of electrocardiography. Introduction to Electrocardiography, or ECG. The electrocardiogram, or ECG, is an essential tool in cardiology that allows us to visualize the electrical activity of the heart. It is a non-invasive, painless, and quick diagnostic method that plays a critical role in detecting and monitoring cardiac conditions. From identifying life-threatening arrhythmias to evaluating the effects of treatment, ECG interpretation is a fundamental skill in modern medicine. Whether in an emergency room, an intensive care unit, or even during a routine checkup, ECGs provide valuable real-time information about heart function. What is an ECG or EKG? An ECG, or EKG, from the German word electrocardiogram, is a test that records the heart's electrical impulses and translates them into a graphical waveform. Every heartbeat generates an electrical signal that spreads through the heart in a coordinated manner. Electrodes placed on the skin detect these signals and relay them to the ECG machine, which amplifies and records them. The resulting waveform provides insight into the heart's rhythm, rate, conduction pathways, and overall function, making it one of the most widely used diagnostic tools in cardiology. Importance of ECG in medicine. The ECG is indispensable in the diagnosis and management of heart diseases. It helps detect arrhythmias, myocardial infarctions, ischemia, conduction abnormalities, and many other cardiac conditions. Beyond its diagnostic capabilities, ECG is crucial for monitoring cardiac function in patients undergoing treatment for heart disease, those with implanted pacemakers, and individuals recovering from surgery. In emergency medicine, ECGs provide immediate information that can be the difference between life and death, guiding clinicians toward rapid and effective interventions. The cardiac conduction system. The heart's ability to beat rhythmically and efficiently is governed by its electrical conduction system. This system begins with the sinoatrial or SA node, the heart's natural pacemaker, which initiates each heartbeat at a rate of 60 to 100 beats per minute. The impulse then travels to the atrioventricular or AV node, where it experiences a slight delay to allow the atria to contract and fill the ventricles before they contract. From there, the impulse moves through the bundle of His, which splits into the right and left bundle branches, ensuring that the electrical signal reaches both ventricles simultaneously. Finally, the Purkinje fibers rapidly distribute the impulse throughout the ventricular muscle, triggering a coordinated contraction. This well-orchestrated electrical flow ensures that blood is pumped efficiently to the lungs and the rest of the body. At the cellular level, this process is governed by the action potential of nodal cells, which possess automaticity, the ability to generate impulses without external stimulation. These cells gradually depolarize until they reach a threshold, at which point an electrical impulse is fired, maintaining the heart's rhythmic contractions. Understanding the heart's electrical system. Each heartbeat is the result of a precise electrical cycle that allows the heart to contract and relax in a coordinated fashion. This cycle is captured on an ECG as P waves, QRS complexes, and T waves, each representing a different phase of cardiac conduction. The P wave corresponds to atrial depolarization. The QRS complex represents ventricular depolarization, and the T wave signifies ventricular repolarization. A deep understanding of these components allows clinicians to assess cardiac function and recognize abnormalities that may indicate disease. The cardiac action. Potential. At the cellular level, the heartbeat is driven by the cardiac action potential, which follows a distinct sequence. Phase 0, or rapid depolarization, occurs when sodium ions rush into the cell, creating a sharp electrical spike. Phases 1 and 2, early repolarization and plateau, involve calcium influx and potassium outflow, ensuring a sustained contraction that allows the heart to effectively pump blood. Phase 3, repolarization, occurs as potassium rapidly exits the cell, restoring the electrical balance. Finally, phase 4 is the resting phase, during which the cell prepares for the next impulse. This process, which happens in milliseconds, is the foundation of every heartbeat and is reflected in the ECG waveform. Basic principles of electrocardiography. The ECG captures the heart's electrical signals and represents them as waveforms. Depolarization activates heart cells, triggering contraction, while repolarization restores them to their resting state. By analyzing these electrical patterns, clinicians can detect rhythm disturbances, conduction delays, and ischemic changes, all of which provide essential clues about a patient's cardiac health. Historical background. The history of the ECG dates back to the 19th century, when researchers first discovered the electrical properties of the heart. However, it was Willem Einthoven who revolutionized cardiac diagnostics by developing the first practical electrocardiograph in the early 20th century. His contributions earned him the Nobel Prize in 1924. Since then, ECG technology has rapidly advanced, evolving from bulky machines to compact digital devices and AI-assisted systems, making ECG interpretation more accessible and precise than ever before. ECG machine, components and function. An ECG machine consists of several essential components. Electrodes are placed on the skin to detect electrical activity, and leads transmit these signals to the machine. The amplifier strengthens weak signals to ensure clear waveforms, while the recorder translates them into a visual representation on paper or a digital screen. Together, these components provide a real-time assessment of heart function, aiding in diagnosis and treatment planning. 12-lead ECG system. Overview. The 12-lead ECG is the gold standard for cardiac assessment, providing a multi-angle view of the heart's electrical activity. By placing 10 electrodes on the body, the machine generates 12 distinct views, each offering critical information about different regions of the heart. This comprehensive approach allows clinicians to detect conditions such as ischemia, infarctions, conduction blocks, and arrhythmias with precision. Limb leads, placement and purpose. Limb leads provide key insights into heart activity by recording electrical signals from different axes. Lead 1 captures lateral activity. Lead 2 and 3 focus on the inferior heart, and the augmented leads, AVR, AVL, AVF, enhance these perspectives. Proper placement of these leads is crucial for accurate interpretation. Precordial leads, placement and purpose. The precordial leads, V1 to V6, offer a detailed view of the anterior, septal, and lateral walls of the heart. They help in detecting ischemic changes, conduction abnormalities, and ventricular hypertrophy. Correct positioning of these leads ensures an accurate and reliable ECG reading. The 12-lead ECG system. At a glance, the 12-lead ECG system provides a comprehensive multi-angle view of the heart's electrical activity. By strategically placing 10 electrodes on the limbs and chest, the system records 12 distinct leads, each capturing the heart's electrical impulses from a different perspective. These 12 leads combine to create a three-dimensional representation of the heart's function, which is essential for identifying conditions like arrhythmias, ischemia, myocardial infarction, and conduction abnormalities. Understanding how each lead contributes to this overall picture is fundamental for accurate ECG interpretation. Step-by-step guide. Limb. Lead placement. Limb lead. Placement is a fundamental step in obtaining an accurate ECG. Start by preparing the patient. Ensure they are comfortable and explain the procedure. The electrodes should be placed on the limbs, wrists, and ankles, ensuring firm contact with the skin. After applying the electrodes, it's crucial to verify their placement, avoiding bony prominences to ensure a clear signal. Correct lead placement is essential to avoid misleading interpretations and guarantee that the ECG accurately reflects the heart's electrical activity. Step-by-step guide. Precordial. Lead placement. Proper placement of the precordial leads is equally important. Begin by identifying the intercostal spaces, palpating the sternal angle to locate the fourth intercostal space. Place the electrodes in the correct intercostal spaces, ensuring secure attachment and avoiding bony areas for optimal signal quality. Each lead provides a specific view of the heart, so accuracy in placement is crucial. Double-check the placement before connecting the leads to the ECG machine, ensuring that each lead is in the correct location to accurately represent the heart's electrical activity. Common errors in lead placement. Incorrect lead placement can significantly distort ECG findings and lead to misdiagnoses. For example, reversed limb leads can cause inverted waveforms, leading to the incorrect assumption of conditions like dextrocardia. Misplaced precordial leads, such as placing V1 or V2 too high, can mimic anterior wall myocardial infarction. These errors highlight the importance of meticulous placement and verification of lead positions. Proper lead placement ensures the accuracy and reliability of the ECG, crucial for correct diagnosis and treatment. ECG paper, structure and components. ECG paper is divided into a grid pattern that helps quantify time and voltage. The horizontal axis represents time, typically measured in seconds or milliseconds, while the vertical axis reflects voltage. Each small square on the grid represents 0.04 seconds and 0.1 millivolts, with large squares representing 0.20 seconds and 0.5 millivolts. These measurements are essential for assessing the duration and amplitude of the different ECG components, such as the P-wave, QRS complex, and T-wave. Additionally, calibration marks on the paper ensure that the machine is correctly calibrated to produce accurate readings. ECG grid, small and large squares. The ECG grid consists of both small and large squares, which provide an easy way to measure time and voltage. Each small square represents 0.04 seconds horizontally and 0.1 millivolts vertically, while each large square, composed of 5 small squares, represents 0.20 seconds horizontally and 0.5 millivolts vertically. This grid allows healthcare professionals to quickly and accurately measure the duration of key intervals, such as the PR interval, QRS duration, and QT interval. Understanding the grid is vital for interpreting ECGs and identifying abnormalities. ECG paper measurements. ECG paper consists of small squares that measure 0.04 seconds horizontally and 0.1 millivolts vertically, while large squares measure 0.20 seconds horizontally and 0.5 millivolts vertically. These measurements enable precise evaluation of ECG components like the P-wave, QRS complex, and T-wave, aiding in the diagnosis of arrhythmias, conduction delays, and ischemic changes. Time interpretation in ECG. The horizontal axis represents time, with each small and large square marking 0.04 seconds and 0.20 seconds respectively. Accurate timing is essential for assessing conduction velocity, diagnosing arrhythmias, and evaluating heart rhythm. Voltage management on ECG paper. The vertical axis of ECG paper measures voltage, with each small square representing 0.1 millivolt and each large square representing 0.5 millivolts. These voltage measurements are essential for evaluating the amplitude of various ECG components, such as the P-wave, R-wave, and T-wave. Abnormalities in these waveforms, such as elevated T-waves or reduced R-waves, can indicate conditions like ischemia, hypertrophy, or electrolyte imbalances. Proper voltage measurement ensures that the ECG is accurately calibrated, leading to reliable interpretation. Calibration on ECG machine. Calibration is an essential step in ensuring the accuracy of an ECG machine. The machine is typically calibrated to a paper speed of 25 mm per second and a voltage sensitivity of 10 mm per millivolt. Calibration marks on the paper verify that these settings are correctly applied. The 1 millivolt standardization mark, a rectangle typically 10 mm high and 5 mm wide, is used to confirm that the ECG machine is producing accurate readings. This ensures that the waveforms recorded on the ECG paper are representative of the heart's electrical activity and can be interpreted reliably. The standardization mark on an ECG paper serves to verify that the machine is properly calibrated. It is typically a rectangular mark at the beginning of the ECG trace, representing a 1 MV signal and measuring 10 mm high and 5 mm wide. This mark ensures that the time and voltage scales are accurate, allowing healthcare providers to measure the ECG's components correctly. By checking this mark, clinicians can be confident that the machine is recording ECG data with precision, which is critical for accurate diagnosis and treatment. Normal ECG components. Overview. The normal ECG trace includes several key components: the P wave, QRS complex, T wave, and ST segment. The P wave represents atrial depolarization, while the QRS complex reflects ventricular depolarization. The T wave indicates ventricular repolarization, and the ST segment represents the phase between ventricular depolarization and repolarization. The PR interval, QT interval, and ST segment provide additional insights into the heart's conduction times and rhythm. Recognizing these components is the foundation of ECG interpretation. P wave, characteristics and significance. The P wave represents atrial depolarization, the electrical activation of the atria, which precedes atrial contraction. It typically has a duration of 0.06 to 0.12 seconds and a height of less than 2.5 mm. The P wave's shape and size can provide valuable information about atrial health. Abnormalities in the P wave, such as peaked or notched P waves, may indicate atrial enlargement, atrial arrhythmias, or conduction issues. PR interval, measurement and importance. The PR interval is measured from the beginning of the P wave to the beginning of the QRS complex and reflects the time it takes for the electrical impulse to travel from the atria to the ventricles. The normal PR interval ranges from 0.12 to 0.20 seconds. A prolonged PR interval may indicate first-degree AV block, while a shortened PR interval could suggest pre-excitation syndromes, such as Wolff-Parkinson-White syndrome. QRS complex, formation and significance. The QRS complex represents ventricular depolarization, the electrical activation of the ventricles, which leads to ventricular contraction. It has a normal duration of 0.06 to 0.10 seconds and varies in amplitude based on the lead placement. A wide QRS complex may indicate ventricular hypertrophy, bundle branch block, or ventricular arrhythmias, while pathological Q waves may suggest a myocardial infarction. ST segment, identification and importance. The ST segment is the portion of the ECG between the end of the QRS complex and the beginning of the T wave. It represents early ventricular repolarization. Under normal circumstances, the ST segment is isoelectric, meaning it lies at the baseline. However, elevation or depression of the ST segment can indicate conditions like myocardial ischemia, pericarditis, or myocardial infarction. T wave, characteristics and significance. The T wave represents ventricular repolarization, the return of the ventricles to their resting state after depolarization. It is typically upright and asymmetrical. Abnormal T waves, such as inversion or flattening, can indicate conditions like myocardial ischemia, electrolyte imbalances, or drug effects. The T wave's shape and polarity provide valuable insights into the electrical recovery of the ventricles. QT interval, measurement and clinical relevance. The QT interval represents the total time taken for the ventricles to depolarize and repolarize, extending from the beginning of the QRS complex to the end of the T wave. Its normal duration varies depending on heart rate, generally measuring less than 0.44 seconds in men and 0.46 seconds in women. A prolonged QT interval is concerning as it increases the risk of ventricular arrhythmias, including torsades de pointes, which can lead to sudden cardiac arrest. Factors such as electrolyte imbalances, medications, and genetic conditions can affect the QT interval, making its measurement critical in clinical practice. U wave, occurrence and significance. The U wave is a small deflection that sometimes appears after the T wave, though it is not always present. It is thought to represent repolarization of the Purkinje fibers or delayed repolarization of the ventricles. A prominent U wave is often associated with hypokalemia, hypothermia, or medication effects, while inverted U waves may indicate coronary artery disease. Though not a primary focus of ECG interpretation, U waves provide additional clues in assessing cardiac health. Normal ECG intervals and duration. At a glance, each ECG component has a defined normal range, deviations from which can indicate pathology. The P wave should be less than 0.12 seconds. The PR interval should range between 0.12 and 0.20 seconds. The QRS complex should be 0.06 to 0.10 seconds, and the QT interval should remain within normal heart rate adjusted limits. Recognizing these normal values is crucial for detecting arrhythmias, conduction blocks, and electrolyte disturbances. Isoelectric line. Definition and importance. The isoelectric line is the baseline of the ECG, representing periods where there is no electrical activity detected in the heart. It serves as a reference point for identifying ST segment elevation or depression, which is critical in diagnosing myocardial infarction and ischemia. Any deviation from the baseline requires careful interpretation, as even minor shifts can have significant clinical implications. Normal sinus rhythm. Characteristics. A normal sinus rhythm is the ideal heart rhythm, originating from the SA node at a rate of 60 to 100 beats per minute. It is characterized by P waves that are upright in leads 1 and 2, each followed by a QRS complex, with a PR interval between 0.12 and 0.20 seconds. The QRS complex is narrow, indicating proper conduction. Recognition of NSR is the foundation of ECG interpretation, as any deviations from this pattern suggest underlying cardiac abnormalities. Artifact on ECG, types and identification. Artifacts are external interferences that can distort ECG tracings, making interpretation difficult. Common artifacts include muscle tremors, which cause erratic waveforms, wandering baselines often due to improper electrode placement, and electrical interference from nearby devices. Patient movement can also introduce irregular deflections. Identifying and eliminating artifacts ensures accurate ECG readings and prevents misinterpretation. ECG machine filters. Purpose and types. ECG machines use filters to improve signal quality by minimizing noise and artifacts. High-pass filters remove slow-moving baseline shifts, while low-pass filters eliminate high-frequency interference. Notch filters specifically reduce electrical noise from power sources, 50 to 60 Hz. Understanding filter settings is crucial to ensure that clinically significant ECG waveforms are preserved while reducing background interference. Digital versus analog ECG machines. Traditional analog ECG machines record electrical signals directly onto paper, providing a real-time display but limited in storage and post-processing capabilities. In contrast, digital ECG machines offer electronic storage, remote transmission, and advanced interpretation algorithms, enhancing diagnostic accuracy. Digital ECGs also enable AI-assisted analysis, improving early detection of cardiac conditions, and integrating seamlessly into electronic health records or EHRs for better patient management. Congratulations! You have now built a strong foundation in ECG fundamentals. This is just the beginning of the Zero to Hero ECG series, where we will continue to explore advanced ECG interpretation, common arrhythmias, ischemic changes, and so on. ECG reading is a skill that improves with practice, and with each session you'll gain more confidence in identifying critical cardiac conditions. Stay tuned for the next episode, where we dive deeper into ECG waveforms, abnormalities, and clinical applications. See you soon.